and return right away. The next three senators in order are Senator Smith, Senator Romney, Senator Baldwin.
Thank you, Madam Chair, and thank you very much, Secretary Cardona and Secretary Becerra, for joining us today. It's very good to be with you. I'm going to direct my questions to Secretary Becerra. Mr. Secretary, I applaud the Biden administration's commitment to keeping our children safe in school through vaccinations, through masking, through ventilation, and through testing. And this includes the administration's recent announcement that they will ramp up the production of rapid COVID-19 tests and purchase $2 billion worth of rapid tests, which can detect, as we know, up to 98% of cases that are infectious with COVID. So rapid in-home tests are a huge benefit to parents because they can get quick test results, so they know whether they can send their students to school after they've been exposed to COVID in the classroom. And it's also a huge help to schools that are, frankly, I've heard overwhelmed in some cases by asking educators to administer tests and to do contact tracing and on top of everything else that they're doing. Rapid tests are a better alternative than lab-based tests, which can be so frustrating to Minnesota parents and students as students are pulled out of school and activities are put on hold for the days while they're waiting, the 3 days while they're waiting for results. And I know that I believe both Senator Murray and Senator Kaine has raised this issue. As we know, unfortunately, rapid tests are difficult to get a hold of right now. So here's my question, Secretary Becerra. Some policy experts believe that by reclassifying rapid COVID-19 tests as a public health tool rather than as a medical device, that this could help unlock a greater supply of tests while also reducing the price of those tests. So could you talk to us about how the administration is thinking through this recommendation?
Senator, thank you. Thank you, Senator, for the question. And I know this is on the minds of many people, not just here in this chamber, but at home as well. As I mentioned before in responding to some of the previous questions, we have the tests. It's that getting them to the right source at the right time has been difficult. We are now coordinating in far greater ways with our state and local partners. Whereas before it was at the point of contact where the test would be made, that the request could be made for those types of tests. What we're trying to do now is coordinate far better how all of this is done. And what I will tell you is that between the money that was made available through the supplemental appropriation that you all passed, through the money from the ARP, we've been able to provide substantial funds, $10 billion in one case, $2 billion, as you just mentioned, more recently. Another $2 billion was made available to try to make sure that we're reaching everyone. Can we coordinate better? We're going to try to do that with our local and state partners. We at the federal government don't have the capacity to be the administrators of the tests, but we can work in partnership with those on the ground who can do it to make sure that we go where the tests are needed.
And do you think that there is an opportunity to think about reclassifying these tests? I mean, how do you?
That's certainly something we could take a look at. I can get back to you as quickly as possible, talk to the team to find out if that's at all something we can consider.
Thank you. I'd appreciate that. I think that there is an opportunity there, given the high level of accuracy and just as another tool that the administration could have as you are working to ramp up these tests.
Yeah.
So
we've been using every tool you all give us, and we'll look at this one as well.
Thank you very much. I also want to ask you a little bit about the work that we need to do to support students with disabilities, particularly in the context of what has been happening with COVID. Pardon me, this is I should have said, Secretary Cardona, this is directed towards you, pardon me. This is about supporting students with disabilities as we navigate through what has been such a difficult time as in schools. And I am, in particular, I just want to quickly highlight a couple of aspects of support for students with disabilities that we are seeing in my home state of Minnesota. There's many great examples, but recently we've seen educators from Moorhead Public Schools in Northwest Minnesota. They've shared with me how they've been able to make really important investments for their students using American Rescue Plan dollars, thanks to American Rescue Plan dollars. So, Secretary Cardona, could you just quickly, in the few seconds I have, discuss the department's approach to supporting education of students with disabilities and mitigating the learning loss that they've experienced?
Thank you for the question and for the support of the great programs there, thanks to the ARP. You know, we're back. Kids are back. Kids are back in school. That's the best thing we can do for our students with disabilities and all students. They're back in their classrooms with their teachers, with their peers. So the best thing we could do for students with disabilities is the same thing we could do for all students. Get them back in the classroom with those teachers that love them, that want to support them. However, for students with disabilities that might have had interrupted learning, it's really important that we're monitoring where they are today, not where they were in March 2020, and make sure that we're using American Rescue Plan funds to provide enough resources, enough support personnel to give the students what they need today and to make sure that their families feel supported as the students transition back. Thank you.
Thank you very much, Secretary Cardona.